Hello and good evening. I'm Melissa Idris.
And I'm Sharad Kuttan.
Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. Omicron has now replaced Delta as the dominant coronavirus variant in Malaysia. According to the Health Ministry's modelling, the Omicron wave is expected to peak at around the end of March. Now, already COVID-19 cases have doubled in just the past week alone, from about 5,500 cases on February 1st to 11,000 cases, more than 11,000 cases today. Can our public health system handle the latest COVID-19 wave? And what can the government and the public do to minimize its impact? Former Deputy Director General for Public Health, Dr. Luqman Hakim Sulaiman joins us now. Dr. Luqman, yesterday we had the Health Minister Khairy Jamaluddin saying that he's expecting Omicron cases to hit 15,000 soon. And today, DG Nur Hisham said that daily cases are expected to reach 22,000 by the end of March. I'm just looking at these numbers, Dr. Luqman. How concerned should we be with these numbers, considering what we now know about the Omicron variant and its milder or less severe symptoms?
Yeah, okay. Well, my response would be yes and no. I mean, we do have concern about the increasing number of Omicron cases, the COVID cases due to Omicron. In fact, it's a global pattern now that the Omicron is the main dominant variant that is spreading in the world. Globally, it's already about 90% of the infections are caused by Omicron, and the rate of increase of Omicron was very, very fast. It was detected somewhere, November 2020. And by December, they already form about 45% of the total infection. And by January this year, it has reached almost 90%. And this is something that the global community has been expecting to happen. The highly infectious variant will certainly cause an increase in number of cases. The concern, although we know that Omicron doesn't actually cause very severe infection, especially those who are vaccinated, but the numbers still matters. When there's too many cases have been infected with this virus, this variant, particular variant, although only a small proportion of them will develop severe infection, but when the numbers increase very highly, then the proportion also of severe cases also be very high. So our concern is whether our healthcare facilities is capable of managing or coping with that kind of surge in the needs of patients that need to be hospitalized and treated.
Dr. Luqman, if I can ask you at this point, really, because 2 years into the pandemic, there's been conversation about healthcare systems under threat. We see now Denmark, in fact, in many ways, rolling back on mask mandates and such, saying that for Denmark at least, Omicron doesn't represent a threat to their health system. But are all health systems anyway, in a sense, created equal? Has Malaysia, in the last 2 years, do you think, done enough to bolster the healthcare system that we all talk about as being so crucial and which drives so much public policy?
Well, I think there's the issues with regard to our healthcare system in the country in terms of the efficiency and the efficiency of the services and the integration of the public and private sector. I think there's still a big issue there when we could not actually maximize the national resources that we have in the countries. This is inherent because of the issues of the healthcare financing that we are having now. So unless we address this fundamental issue, I think we may have still continue to face this kind of challenges as we continue to face the threat of COVID.
Okay, so one of the tools we have in our public health toolkit has been getting vaccination rates to be at a very commendable level, yes? I'm just wondering, now that we're talking about boosters, and today at the press conference, Kari Jamaluddin said that Sinovac recipients, senior citizens above the age of 60 and above who have yet to get their boosters will, by March 1st, not be able to retain the fully vaccinated status. And he threw the number around, about 1 million senior citizens have yet to get their booster shots. I'm just wondering, from your perspective, Dr. Luqman, what is, how should we be thinking about the rollout for boosters? Why so many have yet to come forward and receive their booster shots, and what can be done to improve this vaccination rate?
Okay, this is another aspect that I think we need to really look very serious. I mean, the focus of our vaccination program in facing this threat of Omicron or any other variant for that matter. Right? We know that there are certain groups of the population who are high risk of developing severe infection. The elderly, for sure. In this country, anybody above 50, to me, 50, some say that more than 60, but looking at our previous fatality data from Delta, we know that even at the age of 50 and above, there's a higher risk of developing severe infection and dying from the infection. So the focus should be on this particular group of people, to drive the vaccination, focus on this group of people. Similarly, with the adolescents and the young adults who have comorbidities, again, another group that we know have higher risk of developing severe infection and dying from this infection. So our strategy should be focusing to this group of people, and move with a more targeted strategy with identifying these people where they are. By now, I suppose that we know where they are. I mean, we have a register of the people who have been vaccinated.
Right.
If we can reach them through my suggestion, why can't we make it a process that, I mean, the appointment for booster more efficient? Because even until today, I find that some elderly, they don't even receive their appointment for vaccination. So something, I mean, to me, this is what that we should be focusing on. I mean, the targeted group of high-risk people that we need to protect as fast as possible.
Okay, so why do you think, Dr. Luqman, that there's been a difference between the very successful first rollout of the first series of immunization, mass immunization, particularly with frontliners and senior citizens? Why do you think it's different now with the booster?
I think looking at the rate that we are getting, we are doing quite well. As it is today, we only got 50% of the population having the booster, right? Which is among the high rate in globally. If you look at it. But the problem to me, what I see is many of the young who may not be in the high risk group are getting it ahead of those who are supposed to be given the priority. I think this is where my concern is. When you make it walk like that one, and of course, you can have that walk-in kind of program, but we must target the high-risk group also in a very
Dr. Luqman, I do think in the past that the government did we'll think of, say, aged care homes were identified, and the government went out and actually brought the vaccinations, as it were, to them. So maybe those kinds of strategies. I want to come back to the issue of Omicron, the wave, and you can help our audience understand what it means. And today, Kari Jamaluddin, the health minister, at his press conference said they are doing mathematical modeling that shows that there will be a peak period. They can identify, I think at least at this point, it might be in March sometime. And so, how does mathematical modeling help policy formulation? What do you think, if you can help us understand, is the main takeaways from these types of strategies to plan a better, more efficient public health response?
Okay, I mean, if they already able to project what is the number in 2 weeks from now, 3 weeks from now, you know the proportion of those who are going to develop a severe infection. Even you see that it's very low, 0.3%, for example. But 0.3% of 1,000 cases is more than 0.3% of 100 cases, isn't it? When if you project that in mid-March, your number can reach up to 50,000 cases, for example. It's 0.3%. Then the number of people, the number of ICU beds is required for that proportion. You should know already by now. So, I hope, by this time, the ministry already have identified how they're going to ensure that these facilities will be there when the need's there.
Right. And this is our third year into the pandemic. What have you observed? I mean, have we sufficiently strengthened our health systems, our health services to deal with not just the Omicron wave and the expected wave, but maybe in the future there might be other variants, other waves. Have we learned from the past 2 years?
I'm not sure. I don't know. I mean, until today, for example, the case notification system, which collapsed during the last session during Delta time, that triggered the collapse of the healthcare system. I'm not sure whether that system is already up and running, the so-called automated system that we've been asking for. So if we are not prepared with that kind of system, because we need the system, the district health office need this efficient system so that they be able to identify the cases. They are able to identify who need to be monitored closely for any eventuality. Without this good system, then we are going to face again that problem. During the last session during Delta, we have to mobilize 1,000 volunteers to help the PKDs to do contact tracing and checking with the people at home whether they are suffering from severe symptoms or not. So just imagine if the system is still not put in place with the surge of Omicron, we might be facing the same problem again. So I'm not sure. I mean, that's from that point of view. I'm not sure whether our healthcare system has already really been in place to manage any new surge of number of cases in the future. I hope they already they have a system that work well for them to be able to identify and detect the cases and monitor these cases at home before they get and advise them appropriately when they are required to be in the hospital. Because basically in COVID, it's important to ensure that we identify the patient that need to be admitted as soon as possible to avoid all those issues of BID that we have been facing with Delta previously.
Dr. Luqman, thank you so much for your time tonight. Former Deputy General for Public Health, Dr. Luqman Hakim Sulaiman. We're going to take a quick break on Consider This. We'll be back with more on this topic. Stay.
Bila mengharungi hari suka, berkongsi atau mengguna peranti lama, mungkin jalan terakhir. Usah risau, dengan Maxis Home Fiber, kini keluarga anda dapat menikmati peranti terbaik. Jadikan peranti terbaik sebagai pintu ke alam fantasi. Kerja dengan cekap, main pun lagi cekap dengan peranti berkualiti. Saat penuh keriangan dengan setiap permainan. Bawa pulang Maxis Home Fiber, bawa pulang lebih keriangan.
Selamat datang ke Yang Mana Satu Idaman You. Jika anda ada RM109, mana satu yang anda mahu? 90 saluran Astro atau internet laju? Persoalannya, kenapa you kena pilih kalau semuanya ada dengan bundle jimat? Internet laju dan 90 saluran Astro hanya RM109 sebulan sahaja. Kan? Call 03-7481-3000 sebelum promosi habis.
Setiap orang punya wira mereka tersendiri. Mereka yang tiada sempadan masa.
Okay, we need to protect humans from the deviant.
Time to get back to work.
Mereka yang anda temui setiap hari.
You had my back. I'm proud of you.
You can even give me a few pointers.
It's like a real team out there. Let's go.
Mereka yang memberi erti kebebasan. Dan mereka yang membuatkan anda tersenyum.
It would be my pleasure.
I've been looking everywhere for you. It was amazing! Himpunan Wira dengan Astro Movies Band. Layari laman web atau WhatsApp kami untuk maklumat lanjut.
Ingin dapatkan yang terkini dari Sarawak dan Sabah? Pastikan kita Nangga, Awani Borneo setiap hari jam 7 malam di Astro Awani.
Hi, thanks so much for staying with Sharad and I on Consider This. However, if you've just joined us on the show, we're discussing the best public health approach to the latest COVID-19 wave as Malaysia grapples with another 5-digit rise in daily cases as Omicron spreads across the country. Joining us now, we have Professor Dr. Sanjay Rampal. He's an epidemiologist and public health expert with University Malaya. Dr. Rampal, following the press conference by Kari Jamaluddin today, who says that we're fully in the Omicron wave. We're expected to hit the peak of the Omicron wave by the end of March. What are some of your biggest concerns, or do you have concerns compared to the past 2 years?
Good evening, Melissa and Sharad. Thank you for having me on. So there are a couple of concerns actually with the Omicron wave. I think one of the major drivers behind this future wave to come is the susceptibility of the population. It's just that we have a high number of susceptible population to Omicron variant, and that's going to drive the wave, the oncoming wave. Now, if you look at the peak of the wave, so even though the MOH said it's going to be in March, I think the peak will be coming in about 2 to 3 months. However, I feel that we can better manage the oncoming Omicron wave by preparing our public health services, our testing facilities, and primary healthcare facilities to cope with the expected exponential increase in demand. And I think it was good today that MOH announced that they had reactivated the National COVID-19 Rapid Response Task Force. Preparing surge capacity at the district levels will lead to actually lower levels of community-19 transmission. Now, though the stress to our hospitals will be relatively lower in this new Omicron wave, I expect actually a very much higher demand for primary healthcare services. So that is one main, if you're talking about main cause of concern, I think the preparedness, and I think Ministry has addressed the preparedness with the Rapid Response Task Force. But I think we should be looking out for more demand for primary healthcare services during this Omicron wave, rather than the demand for the end of spectrum or ventilation and oxygen support.
Dr. Rampal, I do want to ask you about your use of the expression "the susceptible segments of society." Now that we are, a community that's essentially been highly vaccinated, I don't think that it's in dispute. Doesn't that change the nature of who is susceptible? I know vaccination doesn't make us immune to infections, right, or in fact getting severe COVID, but hasn't it changed the game significantly?
Very, very good point. So what vaccination has shown is it has very good short-term protection against transmission, right? But for longer-term efficacy, we're talking about 6 months and so on and so forth. The efficacy of vaccines actually reduced greatly for 2 reasons. Number one, attenuation over time, and number two, that the Omicron variant is actually different from the variant used in the vaccines. right? Now, however, what we do see from evidence is that vaccination does still protect us from severe disease and from mortality. That is why I think that even though we have a population that's highly vaccinated, a high proportion of our population is vaccinated, we are still susceptible to the Omicron variant, number one. Number two, what boosters do is they will provide a temporary a protection for temporary duration of, let's say, 3 months. But after those 3 months, the susceptibility to transmission will increase. So the efficacy towards transmission decreases with time. And that is just something that we have to expect.
Okay. May I also follow up on something you said a little bit earlier? You pointed out that you're expecting there to be high demand for primary healthcare. I'm just wondering, higher demand for primary healthcare. How would you like to see primary healthcare being boosted?
So, like what they have announced now, right? So, if you look forward, right, one of the big things about the Omicron variant is that the rate of increase is exponential, right? So we're seeing, let's say, 10,000 cases today. We may see 20,000 cases in a month, and more than that within the next 2 months. So what happens is when we have so many daily cases happening, many of these are actually either asymptomatic or mildly symptomatic. However, even though they are mildly symptomatic, many of them will want to seek care, right? So if we look at our, let's say, primary health, our clinic kesihatan, for example, right, or we can take our GPs. Moving forward, we should be prepared to treat COVID cases, category 1, category 2A, right, those with mild symptoms, actually in our clinics. The use of CACs are good, but one big problem with CACs, these are large centralized areas of operation, which becomes less sustainable when a large proportion of our population becomes sick. So rather than having large centers, then it makes sense to have actually decentralized clinics who can actually treat these mild cases of COVID moving forward.
Dr. Rampal, in today's press conference, the health minister actually advised people not to go to those big centers if they test positive. I think it's based on the assumption that people are self-testing, that if they do a self-test, right? I mean, in fact, the suggestion is you stay home. Is that sound? Does that make a good healthcare strategy? Make for a good healthcare strategy?
So at this point, I must say, when the health minister came out and said his speech, I actually fully agree with many things of what he said, right? So I think first of all, there's clearly a change of management in this wave as we live sustainably with the virus. The pandemic management appears to be moving from a very top-down, authoritative and punitive approach previously to now what he called or what he explained as more person-centered and community-driven approaches. So now there's actually now more responsibility at the personal level in preventing the spread. Now, coming to what you mentioned about when I test positive, what do I do? Do I straight away go to CAC? So the current guidelines is to, number one, report yourself using MySejahtera, right? So whereby a digital HSO will be given, you will receive a flag on your MySejahtera stating that you should be isolated for a certain amount of time based on your vaccination status. In addition to that, there's also the self-monitoring and daily health assessment tool that's supposed to be completed on the MySejahtera. But there are few parameters there. Like, for example, you need to monitor your oxygen saturation, you need to monitor your blood pressure, your heart rate, so on and so forth. Now, for those very mild cases, the point to note is this is all sufficient. But typically when your symptoms worsen, I think you would need to get further consultations and medical care. Currently, because our numbers are not high, I'm really sticking with this, that our current numbers are not high, right? We're just getting used to a new baseline high, a new baseline level which is higher than previously. The levels will become a lot higher in the future. So when we get those numbers, so the number of mild cases themselves become a lot, right? CAC is a very difficult model to deal with high volumes of patients. That is when, as I said...
Okay, I understand that.
Yeah.
Dr. Rampal, can I follow this up though? I mean, when you're looking at a public health strategy, the character of your society matters, doesn't it? There are issues of the digital divide. There are issues of poverty in this country, zones of this country where people might not have the resources either to log in constantly to MySejahtera, self-test, and even the question of health literacy in order to conduct all these things that the plan seems to be predicated on. Do you think these are realistic strategies or strategies that assume that people are kind of middle class, urban, sophisticated, have a sense of, go on YouTube and check things out? I mean, is this realistic?
So I do agree with you that there's equity problems with regards to the age divide, with regards to the digital divide. Now, specifically to this plan, I think this is the first time we have heard of a plan from MOH, right? At this point of time, I think that at this point of time, and he also mentioned during the speech, if I'm not mistaken, that those in the rural areas will still rely on the government healthcare facilities. Now, using MySejahtera has its issues, right? Some of them will be sorted out. But what I do feel is it will work for now, but as we get the surge coming up, I think the Ministry of Health will reassess and they will recalibrate the activities. So I think one big question right now, right, if you were to think about it, is the cost of actually suddenly opening up many CACs, right, versus trying to do it efficiently. And I think what the model they may have used, actually I'm not sure what the reason behind what they did, but the model they did may be based on efficiency, whereby they're using the current CAC facilities and then with possible planning for the surge. Now, we have there's no plans so far from the ministry on the surge preparation. And I do agree, in my opinion, we do need to prepare for that surge. The surge is coming in about 6 weeks or 6 weeks to 2 months.
Okay. In the couple of minutes that we have left, I want to kind of zoom out and ask you to take a look at the trajectory of this pandemic. I'm just wondering what it means, because it was announced that the Omicron variant is now the dominant version in Malaysia. And I'm wondering what that means for the future trajectory of this pandemic. What does that mean? Does that mean Delta will eventually be wiped out here? Or how are you viewing this announcement?
So what I do see is just because of the infectiousness, Omicron will overtake Delta, right? It will just wipe out Delta. Now, with the establishment of Omicron in the community, what will happen is, number one, is the baseline levels will go up. So if you think back on the baseline levels for Delta, it was hovering around 4,000 to 5,000 daily cases. I know at the end I'm going to tell you to desensitize the daily cases, but it's a very easy metric. Right? So we were used to 4,000 to 5,000 daily. Now with Omicron, which has doubled the infectiousness, I would say that the new baseline, right, for the coming months is 8,000 to 10,000. So 8,000 to 10,000 does not actually represent an outbreak, you see. To me, a real wave from Omicron would be about up to 50,000 daily, and we would reach surge capacity when it's higher than 50,000 daily, between 60 and 80,000 daily cases. So one of the big reasons why we can tolerate so many more cases is the successful implementation of the National COVID-19 Immunization Program. There's no running away from that. That first primary vaccination, the immunization program, did a lot, because what it did was it decreased the severity of Omicron in a vaccinated population compared with Delta in an unvaccinated population, right? So the point here is, if we look at trajectories, I think 8,000 to 10,000 may be the new normal. We're not sure. We're still very new in this. However, there will be certain extraneous factors, like reasons for mass gatherings, for example, right? Now, these extraneous factors may actually accelerate or exponentiate that increase. And once we overwhelm our public health capacity to control the disease, that's when we will have the surge, that exponentiation, the shoot-off in the daily cases. That will then be followed by a higher need in primary care. The last thing that happens usually when we talk about trajectories and the evolution of cases, the last thing that happens is actually ICU care. And the way I'm seeing it, even with 50,000 daily cases, our ICU, the need for Cat 4 and Cat 5 may not be so high. We may just need about 750 beds. Now, whether we have 750 additional beds, coming to the question by Sharad earlier, whether our healthcare capacity has reserve capacity. Now, that's a good question. I think that's what we should prepare for.
Well, Dr. Sanjay Rampal, thank you so much for joining us on the show today. Epidemiologist, public health expert, wrapping up this episode of Consider This. I'm Melissa Iris.
And I'm Sharad Kuttan, signing off for the evening.
Thank you so much for watching. Good night.